I'm Alessandro Santambrogio. I'm the marketing director of Intercare, and I think that this session is possibly one of the key sessions in this Intercare because Italy is, generally speaking, still a market to be made in medical tourism. It is a market to be made, as we have heard yesterday and this morning, in terms of incoming. So abroad, Italy is still not perceived as a medical tourist destination. So we need to build awareness. And on the other side, also Italian hospitals still need to structure an offer for the foreign market. It is also a very complex market because on one side you have the medical offer, on the other side you have a lot of other ancillary offers which have to fit together in order to really create a value chain for medical tourism. The leading medical tourist destination nations all have established this value chain, which starts from the government, which sets the guidelines. We have heard this morning, for example, how Croatia works with the government, which has included medical tourism as one of the key pillars to develop tourism in the area. The health tourism is also changing laws. I think they have just approved, or they are going to approve in a few days, a law which removes the ban for public hospitals to receive foreign patients. So they are helping the sector to be more competitive and develop the offer. And all these nations have built clusters. For example, Spain has Spain Cares, which is a cluster which groups the association of hospitals, of tour operators, of airlines, and so on. We believe that this is necessary also for Italy. So Italy still lacks a cluster. There are some contacts, of course. Some hospitals have already built, or groups have already built contacts, has started their value chain, but it's not yet done at let's say, at an institutional level, at a structured level. So it is a matter of choice of each rule. And so we wanted to have in this round table representative of clinics, representatives of hotel association, of tour operators, who is coming because he was tangled in another meeting and should reach us around 3. And we have also operators of different levels of the value chain, so clinics, facilitators, companies working with insurance and governments, and operators, so that we can start sharing experiences and we can start learning from each other and benchmarking what are the needs of each part of the value chain, and hopefully and possibly start a mutual cooperation. So we will have today, we will start with two cases of two hospitals. One is Auxologico, Istituto Auxologico, with Emanuele Fresa, who started some time ago to move into internationalization, and so it brings the experience of an established hospital internationalization. Whereas we have Francesca Perazzini from Clinica San Francesco, who wants to move into this market, and so they probably have different needs. We will talk with Nada Fayyad from Bishur, which is from Dubai. And she's the CEO of a company which works, is between providers and governments and insurances, so creates links to bring patients. Deborah Duncan, who is a facilitator, so again in the middle of the value chain between hospitals and the managers. We will have we have here Luigino Poli, who is from Federalberghi, so the representative of the hotel side, and we'll reach us Nardo Filippetti, who is the president of ASTOI, the Association of Tour Operator, and then to close we will have the cases, the experience of Aratravel. They are well established into bringing patients from Italy for hair transplant, so they have a tour operator, and Access Medicare, which takes care of incoming towards Malta, so we'll have that.